معكم زميلكم دكتور محمد من الإدارة العامة لمكافحة العدوى. اليوم إن شاء الله راح نتكلم عن توبيك يعني يعتبر توبيك هام وتوبيك من البيسك اوف انفكشن كنترول اللي هو الستاندر والترانسميشن بيست بريكوشن. start point for our lecture today. راح يكون عندنا المفهوم حق التشين اوف ذا انفكشن، راح يسهل لنا مفهوم التوبيك اليوم اللي هو الستاندر والترانسميشن بيست بريكوشن. You talk in the previous lecture about the chain of the infection. We have several factors should be present to the cycle of the infection is completed. The one is the harmful microbe, the presence وجود الميكروب المسبب للمرض أو الباثوجين. Then this microbe hide and they can grow and multiply in the reservoir. Then they can found a way to get out of the reservoir and mobile and get away to be to enter the susceptible other host or next person at risk. And this is the cycle. From understanding the chain of the infection, we can know the importance of the standard precaution, and we will explore together what are the standard precaution. طبعا الستاندرد precaution هو بالعربي الاحتياطات القياسية أو الاحتياطات الأساسية لمنع حدوث العدوى، وراح نتعرف إن شاء الله خلال السلايدات القادمة إيش هو الستاندرد بريكوشن وإيش هو الترانسميشن بيست بريكوشن وإيش الفروقات فيما بينهم. In the dentistry, the general route for disease transmission، طرق انتقال المرض في عيادات الأسنان إما عن طريق الدايركت كونتاكت. direct contact that mean direct exposure with the lesion or the infected body fluid like the blood and saliva. You are usually in the dental work, you are exposing to the oral cavity of the patient, so the possibility of direct exposure or direct contact with this fluid and secretion of the patient, and we call it, this is the direct contact. It's also include the inoculation injury like the needle stick injury، الإصابات بالوخز أو splatters of the blood، تطاير الرذاذ أو تطاير البلد أثناء العملية أو أثناء البروسيجر. الأذر ميثود الانdirect contact فيها contaminated dental instrument، indirect exposure to contaminated instrument, to contaminated surfaces or to contaminated material. Also we have in the dental clinic the inhalation as a method of disease transmission, inhalation of infectious aerosol generating from the dental procedures such as the tooth preparation with high speed. You are usually using the high speed handpieces and the ultrasonic scaling, and this is can generate the aerosol, and we call it this method of disease transmission by the inhalation. Preventing transmission with standard precaution. Standard precaution are infection prevention practice used to avoid the transmission of infectious agent. So what are the main purpose of standard precaution? To minimize or avoid the transmission of infectious agent in the clinical setting. It is the first line of defense to break the chain of the infection. زي ما ذكرنا هو الاحتياطات القياسية اللي هي تعتبر خط الدفاع الأول لمنع حدوث انتقال العدوى، وهو عبارة عن ممارسات أساسية يتبعها جميع الممارسين الصحيين لجميع المرضى بغض النظر عن حالة المريض، عن وجود عدوى لدى المريض أو عدم وجود عدوى لدى المريض. What are the standard precautions? The purpose زي ما ذكرنا the standard precaution is to decrease the risk of transmission of the bloodborne and other pathogen from known and unknown source. So it's applied to in all the patient care setting, regardless we know the the patient is suspected or confirmed of any infection. This precaution applies to contact with the blood and all the body fluid secretion and excretion, regardless of whether they contain blood, non-intact skin, or the mucous membrane. We will apply this precaution in during all the patient care setting. Also, in the dental care, we usually know the saliva has always been considered as a potential infectious agent. We are dealing with the oral cavity of the patient. We are exposing to the secretion or to the saliva of the patient, and we consider the saliva as a potentially infectious material in the dental care infection control. So what are the standard precautions? The standard precaution definition: this is the minimum infection prevention practice that apply to all the patient care, regardless of known or suspected infection status. It's assumed that the patient blood or body fluid may be infectious even when asymptomatic. فمعناته إنه الستاندرد precaution, the minimum infection prevention practice, we apply this practice to all the patient regardless they are infected or suspected with infection or not. It prevents the dental healthcare person from acting as a vector for healthcare infection or healthcare pathogen. So they are designed to protect both the dental healthcare worker and to prevent the dental healthcare worker from spreading the infection to the patient. The effectiveness of standard precaution depends on how well each step followed, and we will know what are the components of the standard precaution. First, I want from you to know what are the standard precaution. It is the minimum infection prevention practice. We apply this practice or we apply this precaution to all the patient in all time while we are dealing with the patient. So what are the components of the standard precaution? The hand hygiene, the right way of doing the hand hygiene, the duration of the hand hygiene, and you take the hand hygiene method in the previous lecture. The use of personal protective equipment as a part of the standard precaution, the right use of the PPE, the right donning of the PPE, and the right doffing of the PPE, respiratory hygiene or the cough etiquette, and this is a separate lecture. We will cover it inshallah in the next week. The sharp safety engineering and work practice control, والتعامل الآمن مع الآلات الحادة سواء عن طريق استخدام أجهزة ذات تصميم هندسي تقلل من خطر هذه الأدوات الحادة، أو الورك براكتس كنترول اللي هو الممارسات السليمة لاستخدام الأدوات الحادة. السيف انجكشن براكتس، الحقن الآمن using aseptic technique for parenteral medication. Sterile, using the sterile instrument and devices, and cleaning and disinfection the environment of the clinic. This all the component of the standard precaution. Standard precaution and transmission-based precaution. When standard precaution alone cannot prevent the transmission, they are supplemented with transmission-based precaution. في حال إنه كان standard precaution وحده لا يكفي للوقاية من انتقال العدوى. They are usually supplemented with transmission-based precaution. هنا يجي مفهوم transmission-based precaution إنه عبارة عن extra measure support the standard precaution to prevent the transmission of the infection. Dental settings are not typically designed to carry out all of the transmission-based precautions that are recommended for the hospital. As we know, the dental setting is different from the hospital setting, so the standard and the transmission-based precaution are designed for the hospital, but it's very important to also use it in the dental clinic whenever possible. The patient, however, do not usually seek routine dental outpatient, and we all know when the patient is sick or they have symptoms, they are not routinely go to the dental care when they are actually ill with disease requiring the transmission-based precaution. Standard precaution, the main difference between the standard precaution and the transmission-based precaution, that the standard precaution apply to all care activity regardless if the patient suspected or confirmed with the infection status. Transmission-based precaution, it is extra measure or added measure with the standard precaution to prevent the spread of the disease from patient with known or suspected disease. We have three main type of transmission-based precaution. The first one, contact precaution. It is precaution used for disease that can be transmitted during contact with the patient، اللي هي احتياطات العزل التلامسي تنتقل عن طريق التلامس، فهي تعتبر الاحتياطات العزل التلامسي. عندنا أيضا العزل الرذاذي droplet precaution، حرب للميكروبات التي تنتقل عن طريق الدروبلت أو عن طريق الرذاذ. الرذاذ هو عبارة عن large respiratory droplet. وعندنا البريكوشن الأخير airborne precaution للميكروبات that passed along through the air. Pathogen are very small and remain suspended in the air. So the main difference between the droplet precaution and the airborne precaution, the microbe in the droplet precaution size is large and not sustained or going far in the air because of the particle size, while the airborne is the particle size is very small, so the microbe can sustain in the air for a long time and going for a distance so far. The patient should be placed into appropriate precaution as soon as possible while awaiting confirmation or suspected diagnosis. That means we have to apply the transmission-based precaution when the patient is suspected and even if we are waiting for confirmation of the patient status. All of this measure to prevent the transmission of the infection inside the clinic. Contact precaution, it is a method used to contain disease that are spread by the direct contact. Direct contact, that means contact with the patient skin, including the mucous membrane or the feces of the patient, or the secretion during vomiting, or the urine of the patient, or the wound drainage or other body fluid. The indirect contact, as we mentioned, contact with the patient environment or surrounding of the patient that are contaminated with this pathogen. Known or suspected infection or others that are epidemiologically important, also we are follow for contact precaution. Patient at risk of contaminated their environment with fecal incontinence or diarrhea or uncontrolled wound drainage or other excretion or secretion. Example for contact precaution are or is clostridial deficits or the multi-drug resistance organism, the MDROs. PPE used for the contact precaution, we are using the gown and gloves at the entry point before contact with the patient or the patient environment. PPE should be done prior to the room entry and doffed at the point of the exit. Single patient room is preferred and the patient cohorting can be done in case of the single patient room is not available. A potentially contaminated object include the most frequently contaminated surface like the tray tables or the bed rails or the chair of the dental clinic, the medical equipment like the blood pressure cuff. Dedicated patient equipment is preferred for the contact precaution. The rest of the PPE, we can use it according to the procedure performed. For example, if we anticipate there is splashing of the patient secretion or splashing of the blood from the oral cavity, so we are using extra PPE according to the procedure done for the patient. Very important also to perform the hand hygiene before and after the PPE removal and when needed. Droplet precaution, second precaution, are used to prevent the spread of the pathogen that are passed through the respiratory secretion, do not survive for long in transit, and this droplet are relatively large particles, as we mentioned, that cannot travel through the air very far. So the particle here of the pathogen is large in size, so that are not sustained for a long time in the air. So prevent transmission of disease spread by large respiratory droplet through coughing or sneezing or when the patient talking. Single patient room also is preferred, and the patient cohorting can be done for this type of isolation. Example of the droplet precaution are the seasonal influenza and the Bordetella pertussis or السعال الديكي الباثوجين المسبب للسعال الديكي. PPE for droplet precaution. Face mask is worn upon entry into the patient room, considered to be within 6 feet. So we have to wear the face mask and the distance in 6 feet, at least 6 feet between the healthcare worker and the patient. Respirator or N95 is not, can be used for the droplet precaution in specific situation or specific procedure. Use standard precaution when handling item contaminated with respiratory secretion. The PPE must be removed at the point of the exit. Do not reuse the face mask. The face mask is used once we finish the procedure. We discard it upon exit of the room of the patient. For some infection, the eye protection might be necessary as well, like for example the influenza virus. The rest of the PPE can be used according to the procedure performed. As a rule, we wear the PPE when we anticipate splashing of the secretion or the blood. We can use a more or extra PPE like the face shield and the gown and the gloves. Hand hygiene follow the PPE removal. Airborne infection isolation prevent transmission of infectious agents that are very small and remain viable and suspended in the air over a long distance and long time. So this precaution, we call it airborne infection isolation. Patient placed into a negative pressure isolation room. So here we have a specific precaution that we need a negative pressure isolation room that contain special air handling and special air ventilation inside the negative pressure room. The negative pressure room aim to contain the contaminated air inside the negative pressure room, so prevent the transmission of the infection outside the negative pressure room. This air handling or ventilation capacity include monitoring system that provide the negative pressure relative to the surrounding area, such as the hallway and the air exchange are at a rate faster than the area in the healthcare setting with exhaust directed to the outside or using of the HEPA filter. Example of the airborne infection isolation, it is like the measles or Mycobacterium tuberculosis or the chickenpox. All of this pathogen are under the airborne infection isolation precaution. PPE used for the airborne infection isolation, we have to use the particulate respirator N95 or the powered air perfuming respirator اللي هو الببر worn before the room entry. With the particulate respirator perform, the healthcare worker should do the fit check before or the fit test before entering the area to have a good seal or a good benefit by the N95 to do the fit test before using the N95 for the healthcare worker. The bubber may be selected if the N95 respirator does not fit, so we have to use the bubber. For example, if the healthcare worker have facial deformity or have a more hair in the face, so the sealing by the N95 will not be appropriate for this healthcare worker. So we will use the bubber as a substitute for the N95 for the airborne precaution. The rest of PPE can be used according to the procedure performed as we mentioned before. It is very important to bear in mind that the droplet could be aerosolized in aerosol generating procedure. In the dental clinic, we have a lot of procedure that can generate the aerosol, so it's very important to keep in mind some pathogen transmitted by droplet could be aerosolized in the aerosol generating procedure. For all isolation type, now we will talk about the patient transport. For the all isolation type, as a general rule, limit the transport and the movement of the patient outside of their room. Usually we limit or prevent the movement of the patient outside of their room, but if a must, there should be a good hand-off communication and good coordination between the department that are transport the patient and the receiving department. For the contact precaution, any infected area must be contained or covered, and the healthcare worker should wear the gloves. For the droplet precaution, the patient wear the surgical mask and follow the cuff etiquette when outside of their room, and the healthcare worker should wear the surgical mask only if the patient cannot wear a mask. So the droplet precaution, the patient will wear a surgical mask and follow the cuff etiquette. In case of the patient cannot wearing the surgical mask, the surgical face mask, so the healthcare worker will wear the surgical mask. For the airborne precaution, also the patient should wear a surgical face mask and follow the cuff etiquette, and the healthcare worker should wear the N95 only if the patient cannot wear a surgical face mask. The healthcare worker should perform the hand hygiene after handling or after transporting the patient. Method used to reduce the risk of respiratory pathogen in the dental setting, including the use of transmission-based precaution, which is the contact precaution and the droplet precaution and the airborne precaution. Transmission-based precaution in dental setting. In the outpatient dental setting, consensuous adherence to the source control measure and the standard precaution should be sufficient to avoid disease transmission by the contact route. Contact precautions are used to prevent the spread of the organism among patient and healthcare professionals by contaminated hand and the patient care equipment. Droplet and airborne precaution in the dental setting are used to avoid transmission of epidemiologically important disease spread by the exposure of the oral and nasal mucosa and the pulmonary system, like the COVID-19 and pandemic influenza, the measles and the tuberculosis as example on the droplet and airborne precaution. This precaution rely on the following: the respiratory hygiene and the cuff etiquette, the source control, the work practice control, using of engineering control to reduce the number of potentially infectious droplet and aerosol in the clinical environment. The potential for infection from airborne or droplet exposure is due to the physical characteristic of the particles and their ability to stick to the susceptible tissue in number sufficient to initiate the infection. Also, the survivability and the infectivity will virulence of the pathogen and the immunological status of the person exposed. Defining the characteristic in particle size or the droplet do not remain suspended in the air for the extended period of the time. Particle less than 5 micron, however, can stay airborne indefinitely unless removed by the air current or ventilation and can be inhaled into the lower respiratory tract. So if the particle size is less than 5 micron, however, they can stay airborne indefinitely and unless removed by the air or the ventilation system. Transmission-based precautions should be implemented routinely in case of potentially infectious patient for all the procedure, for the all aerosol generating procedure when there is moderate or substantial community transmission of highly infectious disease or during declared public health emergency. So the transmission-based precaution may be implemented routinely for potentially infectious patient in case if there is moderate to substantial community transmission of highly infectious disease or during declared public health emergency like what we experience in the COVID-19 pandemic issue. Preventing transmission of respiratory pathogen. Transmission. Now we are talking about the experience of COVID-19 and the transmission, preventing the transmission of COVID-19 for droplet and aerosol to spread disease. Viable infectious agent must be present and capable of causing infection in the susceptible host. In some viral disease like the COVID-19, like the influenza and measles, the infectious viral titers may be seen in the patient with or without symptoms. So in some viral, as we mentioned, like the COVID-19 and influenza, the transmission of the infection can be happen with or without the symptoms, with highest level increasing or decreasing over the course of the infection. In other cases like the tuberculosis, only patient with active symptoms and coughing can spread the disease. In specific case of COVID-19, aerosol and droplet associated transmission can occur from patient with or without symptoms. Of particular concern for dental healthcare worker, the virus is present in the salivary gland and possibly other oral tissue. The virus and viable viral particle are consistently present in the saliva in the infected individual or the infected patient and can remain viable and infectious in the aerosols for the hours. Large particle respiratory droplet containing potentially infectious agent are produced when the infected person is coughing or sneezing or possibly just while breathing. This droplet can land on the oral or nasal mucosa, the conjunctiva, or on the surface, or are touched by the dental healthcare worker who then touch their mucous membrane or the eye, resulting in exposure and resulting in transmission of this infection. Droplet and sputter are also generated by the dental procedure using the rotary and ultrasonic dental instrument and even by the toothbrushing. General precaution followed during the pandemic of COVID-19. The dental healthcare workers are advised to limit the number of the staff inside the clinic or inside the area. This is one of the general rule for or the general precaution for lowering the risk of transmission of the COVID-19. Dental healthcare workers are advised to stagger shift or the lunch coffee break when possible to support the physical distancing between the healthcare worker. All the dental healthcare worker and the other employee must be screened daily before the entrance and before the duty with the measuring the body temperature. All the dental healthcare worker and other employees should be self-monitored for the emerging of the fever or cough or shortness of the breath, which is the typical signs of the COVID-19. When dental healthcare workers are confirmed to have the COVID-19, they must follow the recommendation of the employee health clinic regarding the work restriction and resuming of the work. Everyone, also from the general precaution for during the pandemic COVID-19, everyone entering the center should be triaged and asked to wear the face mask to prevent spreading of the infection at the entry point of the center. All the dental facility are encouraged to use electronic payment method to minimize the exposure while using the cash payment. This is also one of the general rule that are used or general precaution that are used during the pandemic of COVID-19. Removing the magazine and reading material or any material that are rotated between the patient to minimize the exposure or rotating the pathogen between the patient. Place transparent barrier in the front of the check-in desk also as to work as a physical barrier to prevent the transmission of the pathogen. The patient waiting area should have a chair that are separated by at least 1 to 5 and to 2 meters, and all the supply for the hand hygiene and the tissues. Also, the signs or education material should be present in the waiting area of the patient, and all the patient should be educated and instructed to use the cuff etiquette and the hand hygiene technique. Also, from the general precaution, the patient may remove their face mask covering when in the dental treatment. So if the patient go to the dental clinic for receiving the treatment, it is allowed to remove their face mask. But after finishing the dental treatment or the dental procedure, the patient is instructed again to wear the surgical mask. Dental healthcare workers should wear the surgical mask all the time, as we remember the universal masking of the surgical face mask during the pandemic COVID-19, including in the break room and other spaces where they might encounter the healthcare worker. If the dental healthcare worker uses the respirator, it should be removed outside the clinic. This is a special situation for the respirator. The N95 should be removed outside the clinic and disposed in the infectious medical waste, and you will take a separated lecture about the medical waste and dealing with the waste. Extended use policy for respirator policy should not be applied in the dental setting. The using of the respirator with suspected or confirmed COVID-19 patient with the aerosol generating procedure is done. Strategy to reduce the transmission risk include avoidance or minimization of certain procedures that may increase of aerosol generating whenever possible, such as the ultrasonic instrumentation. So as we can avoid or minimize the procedure that are aerosol generating procedure. For example, using the ultrasonic instrumentation, we can also use or prioritize the technique that are decrease the risk of aerosolization, like the manual instrumentation or using a low speed handpiece or manual instrument without the water supply as possible as we can to minimize the aerosolization of the pathogen inside the clinic. The using of high volume suction or the dental rubber dam to minimize the droplet or the aerosols, and the use of high volume evacuation or the suction resulted in reduction of particularly by 90 to 93, and the use of rubber dam eliminate virtually all the contamination by at least 90 to 98%. If a rubber dam is used, the only remaining source for the airborne contamination is from the tooth itself. So when we are using the rubber dam, the only source for the aerosolization is the tooth itself while you are doing aerosol generating procedure on the tooth. So the only source for this aerosolization is the tooth. This is very important to use the high volume section and using of the rubber dam to minimize this droplet or to minimize this aerosolization generated during the dental procedure. Suspected or confirmed COVID-19 patient should be avoided from any non-emergency dental procedure and postponed until clear. So only for the emergency. If the case is not emergency, we can postpone the dental treatment for this patient. In case of emergency, dental procedure that are could not be delayed. There are several general rules can be followed. Dentist should require patient to rinse with appropriate oral rinse for 60 seconds for at least 1 minute prior to the examination of the oral cavity. Example for this oral rinse including 1% povidone iodine or 1% 1 and 5 hydrogen peroxide. When possible, the dentist should minimize the use of intraoral radiograph and using the extraoral radiograph as a substitute for the intraoral radiograph to minimize the exposure to the pathogen. Dentists must avoid the aerosol generating procedure whenever possible and use the lowest aerosol generating option when necessary. For example, using the low hand speed handpiece and instead of using the high speed handpiece, using high volume evacuation suction on the dental rubber dam should be mandatory and not optional in case of aerosol generating procedure in the dental clinic. In case of non-avoidable aerosol generating procedure, the dental healthcare worker should wear a certified fit-tested respirator, the N95, or wearing the bubble or surgical face mask if the respirator is not available. The gown, gloves, and the eye protection also should be worn by the healthcare worker. The number of dental healthcare workers present during the procedure should be limited to only those essential for the patient care and essential for the dental procedure support. The visitor should not be present during the procedure. If available, the portable high efficiency particulate air HEPA filter could be used near to the patient chair, but not to putting the HEPA filter behind the dental healthcare worker, ensuring the dental healthcare worker not positioned between the unit and the patient mouth. After a result genetic procedure and the dental treatment, the dental healthcare worker must maintain a proper ventilation before the terminal cleaning and disinfection and utilization of the dental clinic for another patient. We are usually waiting for 15 to 30 minutes following completion of the dental procedure and exit of the patient and all the clinical staff before cleaning and disinfection, and delaying the process of terminal cleaning and the disinfection is mandatory before reusing the same treatment room in order to allow the HVAC system and the portable HEPA filter or the natural ventilation to remove the aerosol from the clinical area, since the air remains contaminated after the dental procedure. As soon as possible, the dental healthcare worker included in the high-risk group for COVID-19 infection should be restricted from the dental care procedure with suspected or confirmed COVID-19 patient. Thank you all. We finish our lecture today, and we will start to receive the question or any information that need to be explained in detail. الصوت واضح للجميع؟
ايوه ما الله يعطيك العافيه، لا انت.
الله يعافيك إن شاء الله. الحين إذا في أحد عنده استفسارات، عنده أسئلة واضحة معكم، هي معلومات